Hey guys, this is Dr. Sandy. Welcome to our video. We're going to be talking about the low back today. If you're new to these videos, welcome. If you've been watching for some time, thank you so much for your continued support. As always, please like, share, and subscribe to these videos if you're getting value from them. So today we're going to be talking about the best stretches for the low back. I'm Dr. Sandy, obviously. I've been doing this for many years now, and as a chiropractor, obviously we do see patients with the low back. So the question first becomes, why do people have low back pain? Why is that such a common issue? Well, I would say that a lot of back problems are actually from too much activity, pushing it too hard, or lack of activity. So you almost need to get into that sweet spot. So what do I mean by that? So maybe someone has a job with a lot of pushing, a lot of lifting. Maybe someone likes to work out and they're lifting heavy weights, which is putting just too much stress on the system. And then at the other extreme, you have people who are just sitting all day, maybe using a computer, maybe a younger person who's trying to study, a younger person who might be gaming a lot, maybe someone has a job where they just drive a lot, maybe someone in real estate where they're in the car a lot, or maybe someone who drives a truck for a profession, maybe someone who has a taxi, Uber, all of those things. So it's from too much activity or lack of activity. Sitting too much actually puts stress on the spine, and the spine is designed to move. For you to have the best quality of life, the spine should be healthy, and I can tell you, especially as you get older, the body needs more care, and especially the spine and the nerve system. So let's jump into it. What are some of the best stretches for the lower spine? So I'm going to show you this, and as always, I'm going to say this again and again. You only do it if you can handle it. It should feel comfortable. If you're watching this and the pain is too strong, I would just wait. Wait till you feel comfortable. Only do what works for you. If you are a patient, you can ask questions. Obviously, if you're working with someone else, I'm totally okay with that. Just make sure that these stretches I'm showing you are a complement to what you're doing. So these are designed to help you. And this is not just for people who have pain. This is also a preventative system as well. We're going to show you stretches that even if you're feeling good, we should always think of the spine like the teeth. So the teeth are something, regardless if they're in pain or not, hopefully for most of us, you're just brushing it every single day. We're just being proactive. We know if there's too much pain in the teeth, we need to see the professional. But regardless if there's pain or not, we're always brushing the teeth. I hope that kind of makes sense. So the same thing with the spine. The spine should not be just taken care of when there's pain. We want to be proactive with it. So having a morning routine, a nighttime routine will be very beneficial, will keep you in the best shape possible. And then if you're recovering from back pain, more of a reason to take care of it. If you've never had back pain, still a good reason to take care of the spine, because we always want to just be proactive. We want to nurture the body, not wait for it to fall apart. So having said that, let's get started. I would say the most important stretch I could show you would be the child pose, which I'm just about to show you. I really like this one. It's relaxing. It really opens up the spine. And I want to share this tip with you. So I'm going to go through all these stretches. Listen to your body. Obviously, I'm assuming you're drinking water, which the spine loves. It needs water. The discs, the muscles, the nerves really benefit from drinking water. Let's say I'm going to go through all of these stretches and you're like, no problem, I have time to do this, Dr. Sandy, there's no issue. I do have a lot of patients who are just super busy. Sometimes mornings can be busy. You're like, oh, how can I, that's just too much. So at least if you can do this, and if you're super busy or you just get up really early in the morning, there's just no time, I would suggest that maybe after work. And then if you're still too busy because you come home, there's just too much to do, at least before you go to bed. That way it'll kind of take the stress off from the day and you're ready for the next day. But the real ideal goal would be twice a day. I'll leave it up to you when you do it. Ideally, if you have the flexibility, first thing in the morning and just before bed. Some of my patients will also kind of do a quick stretch maybe in the morning and then a little more time at night, or it might look the other way around. But please make time. And always remember, even doing a stretch for 30 seconds or a minute, if that's all you have in your day, there's still value in it. There's always, remember the philosophy, something is better than nothing. So the first one, the child pose. So what you want to do, and I'm using this as the top area of the mat, we're going to go like this, we're going to go down like this, and we want to hold. And I got to tell you, so even as I'm doing this, I just love doing this stretch. Really starts to stretch this lower back area. It's taking pressure off the discs. I can't recommend this one highly enough. It's a great way to start the day. It's a great way to end the day. And if you get up in the morning and if you pray or meditate after you're done that, this would be a great way to kind of finish that off. So we want to be in that position. How long should you hold this for? I would recommend in the beginning, depending on your body, I want you to feel a stretch. So we generally tell our patients 30 seconds. If that's easy, you want to extend it. If 30 seconds is way too much, we want to pull back. Now for some patients, even that is difficult. What I would recommend is that maybe in the kitchen or washroom, you can just stand with a countertop, just put your hand there and you could just gently bend. Obviously protect your head, but you're going to just gently bend. You can even do that. And it's kind of like a modified child pose. It's still targeting those groups. So I would say that's a good way to start. From there, what we're going to do next is we're going to have you lying down like this. And what we want to do as well is we want to make sure we're addressing all the different muscle groups. So what I would recommend when you're in this position is we're going to go have the knee come up like this and you want to cross over. Okay, so what I'm doing is I'm crossing over like this. And again, there's a couple of variables you can play with. You can work with how far you're going to go. You can work with how long you're going to hold that position. And it's really helping with the hip muscles, which go into the lower back as well. We're going to obviously do both sides. And I would say try your best to follow this sequence. I would highly recommend it. All right. And again, you're going to see how long you could hold that for. You can actually also do this stretch if you feel comfortable standing and that you feel you can balance yourself. You may want to hold something, but you can actually do this stretch standing as well. So you can do this at work. The next thing you want to do is you want to do a knee to chest. So we're going to have it. Now, some people will do both at the same time. I consider that a more advanced type of workout. I would actually do one at a time and hold. And guys, another thing if I could share with you as I do these stretches, it's not a race. It's not about how many reps you can do and how fast I can finish these. It's all about quality. So I rather you do just a few positions properly. A big question I get from a lot of patients is like, is there more stretches? Is there more stretches? Honestly, I would focus on the fundamentals and really master them. It's not about doing more and more and more. It's about working on the fundamentals. So we're going to just, as best we can, we're going to have it go up and we're trying to bring it up to the chest area as best you can. So we'll do that 1, 2, 3, 4. Now, once we're done from there, what I would recommend, and again, we're going to see what you can tolerate from there, is you want to get the knee and you want to cross over, okay? And this is also good, and as I do this, really stretching, again, the muscles along this area, especially along the hip area, really opening up that area. And you want to use this hand to push, and it just really starts to open up this area. That's common probably for a lot of people, especially if you're sitting at your desk all day in front of the computer. We're going to do that, and then we're going to also do the other side. And you might feel that one side might be tighter, there might be restriction, you're just doing the best you can. And you'll notice too, as I'm showing this to you, I'm not really forcing anything, there should be no fighting. Remember, we're just stretching, so we just want to extend it as best we can. And we're doing that over there. The other one I would highly recommend, again, if you can tolerate that as well. So if you could do a pelvic lift, so we're going to just have this go up. And this is, some people would say it's a stretch. I also think it's actually strengthening the lower back. So we're doing this very comfortable. You're also strengthening your core area, which I think is a good idea. So we're doing that. We're going to have it gently come down. You may just start with a few seconds. I like contracting. This area feels great. It feels comfortable over here as well. See how long you can hold that for. Advanced would be if you could do this, you may want to just do it with just the one leg going up and still going up at the same time. This is definitely more advanced. Other leg up, and then you're just kind of lifting as well. Okay? So from there, and if you've been with me for some time, those are the traditional ones we show. And then I made some videos on this as well recently with the Superman position. Now this one I'm showing as a stretch, but it is also strengthening. So this would be great for someone who has some disc issues where there might be disc bulging, herniation. And again, you really have to use your discretion. We're only going to do things that you feel comfortable with as always. And we're going to be like this. And then what we're going to do is you can have the hands going all the way out and you're just going to lift. You can just drop back and you can just lift. You may want to place your hands in a different area to get some support if you need to. You can even have them on the side. And then we're just lifting. We're just going up. And we're just going to do what we can. And what that's literally doing is pushing the disc back in place. Related from there, and that I would recommend, is that you're like this, and we're going to go into what's called extension and go back as far as we can. I believe in yoga as well, that would be called like a cobra pose. So what we're doing is we're like this, and we're going all the way back and having the head go back, again using our judgment. Now think about some of those things, and then also think that if you are busy or throughout the day, for example, that last one, what's that same concept? If you're on a computer all day, what you can do is while you're seated, you want to go in extension. Always think about the different motions. So if you are sitting in your chair, you can actually do most of these stretches as well. So you can actually, while you're at your chair, if you're so busy and you don't have time, maybe push your chair away from the desk and you're going like this. So we're doing the child pose. While you are sitting in your chair, then what you can do is get the legs, you can cross them over while you're seated. You can actually just, what I would recommend if you're sitting all day, just taking that time to rotate as well. When you move the spine like that, you're hydrating things, you're moving things. Movement will always be a positive for the spine. So I would say focus on that. Always think about hydration. I would also say that if you are computer-based, if you can, every hour, every 2 hours, please make time for stretching. Your body will benefit, and in the long term, you'll just be so much healthier and so much better. If you are athletic or you like to work out, there's different philosophies on this. What I would teach you is try to even do a few stretches before and after. I think that would be a great idea, just again to protect the body. And focusing on these stretches on a consistent basis will help you. And yes, it can help you if you're in discomfort over time. It'll help you, of course, listen to your body and always do what you can tolerate. But I would also say the take-home message is that if you have no back pain, start taking care of it now. And just think it's like brushing your teeth. And as always, that if you can do the stretches, have the good nutrition as well, making time for prayer, meditation, some time for yourself just to recharge, journaling as well. Obviously being active, walking, exercising, doing those kind of things. And then yes, I would also say that going to the chiropractor, having it in alignment, maintaining that alignment so you can have the best quality of life possible, because that's absolutely what you deserve. So God bless you guys. I hope you're enjoying these videos. As always, if you got something that you did learn, or maybe you heard again that you needed to hear, please like, share, and subscribe. I'll be here next week with another video. Hope you're really enjoying, and as always, God bless you, and I wish you the best of health for you and your family and your friends. Thank you so much. It's Dr. Sandy.